We are beings of emotion. As humans, we respond to our emotions. Sometimes we control them. Oftentimes, they rule our lives. Our minds try to make sense of them. But with our minds, we can use our emotions to make changes in our lives and in the lives of others.
At idsMed, the emotion that rules our lives is our collective need. The need to improve and innovate, the need to expand our reach, the need to use that reach to affect people's lives in a nurturing and positive way. And we are compelled to act on that need, to actively care for others to the best of our abilities. Through the best technology available, with the best group of professionals, technicians, practitioners, and partners, united to make a difference in the lives of people who seek medical care and support.
We are idsMed.
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 At idsMed, we offer solutions
To make lives better.
To help those who help others do a better job at it.
To make a real difference in the lives of those who need it most.
With our equipment, planning, and supplies, we turn our desire to help, our passion, into compassion.
We at idsMed are here to deliver the best healthcare quality solutions to improve the quality of life.
This is our goal and mission.
because we know that it is our duty and responsibility to make lives better.
To act with care for the well-being, safety, and health of those around us.
We at idsMed care with a heart because we believe that your life matters.
We take pride in our work-life balance. We understand that to create a positive impact in the lives of others, we must live our personal and professional lives with equal opportunities for growth.
We are committed. You can depend on us to do our jobs consistently and responsibly and help provide the excellent medical service that we all deserve to the best of our abilities.
We speak with truth and sincerity. There's no need for jargons. We know what you need. We are here to help you clearly understand what needs to be done every step of the way.
We act with integrity. Our words mean responsible actions. We aim to deliver the highest quality of healthcare service with honesty and consistency. You can always expect us to do what we say.
We are here for you. Together we can make a difference in the lives of those who need us. Everything we do is a product of our dedication, honesty, and hard work.
We are in many countries in Asia, helping supply the best equipment and solutions to medical institutions and practitioners with the help of our many partners.
And because we care, we are in the Philippines.
With such a strong presence in the region, it is no surprise that we are the leading Asian brand in medical distribution and services. Here in the Philippines, our specialty care areas include
anesthesiology, biomedical services, cardiovascular, diagnostic imaging, emergency care, general surgery, infection control, intensive care, medical consumables, obstetrics, gynecology and prenatal, primary care, respiratory care, and surgical workplace.
Among other leading products are all our equipment, expertise, and experience allow us to offer the best solutions in our many specialty care areas and functions. Apart from our headquarters in San Juan, Manila, we have branches throughout the country in Baguio, Bicol, Iloilo, Cebu, Davao, and Cagayan de Oro. We have a workforce and supply chain of partners and committed distributors that are committed, reliable, trustworthy, and sincerely passionate about doing the best job they can do, because they know that no matter what role they play in our organization, doing the best they can do will make a huge positive impact on the lives of our fellow Filipinos.
From each employee, we can guarantee the kind of dedication that makes a real difference.
We are all here because we know it's our responsibility to do good for our company that supports us.
for our family whom we support.
For the Filipino people who are at the heart of our business, we are working together here and now.
For the greater good of those who need the best care we can possibly give.
We are all in this together.
Together we help.
Together we care.
Together, we make a difference.
People are essential to your business. That's why sickness, outbreaks, and pandemics can be detrimental to your success. Healthy people can add up to a healthy bottom line, and that's where Zuno can help keep things ticking along. Zuno's innovative antibacterial technology provides a long-lasting protective shield against 99.9% of pathogens, with hand sanitizer to protect the skin for up to 24 hours, surface sanitizer for touch points, and antibacterial misting to protect large areas for up to 30 days. Zuno can help keep your team safe and healthy all year round. If it all sounds too good to be true, rest assured it's not. Zuno are leaders in sanitizers. Our technology has been successfully tested against a wide range of bacteria and viruses and verified by a number of lab trials the world over. In fact, Zuno has been successfully tested against COVID-19 in the UK, and the Australia TGA allow us to make COVID-19 claims on our surface product. Leading businesses trust Zuno. Our wipes are used in Qantas Fly Well packs. The London Underground carriages are protected with our mist. And Amazon, United Airlines and Adidas use Zuno too. It's safe to say we're protecting people all over the world from germs. Zuno works by coating the surface with a layer of positively charged molecular pins, which attract and kill negatively charged pathogens by rupturing their cells. And there are no harmful chemicals or harsh alcohols. Need next-level germ protection for your staff and your customers? Zuno has got you covered.
Telehealth is here, but is a call or video conference enough? Can clinicians make an accurate diagnosis without an in-person physical exam? Now they can, with TytoCare. TytoCare has two new telehealth solutions that help ensure a remote diagnosis is the right diagnosis. Tyto Pro for clinicians and Tyto Home for patients. Both solutions include the TytoCare device and a complete telehealth platform for those that need it. Tyto Pro, designed for clinicians, captures and records comprehensive exam data and facilitates the sharing of results between health professionals in remote locations. With its easy-to-use touchscreen, Tyto Pro is an all-in-one digital stethoscope, otoscope, camera, and thermometer. It delivers high-resolution, clinical quality video and images of the ears, throat, skin, audio of the heart, lung, and abdomen, and records temperatures and heart rate. With Tyto Pro, you can extend medical services to remote locations such as home visits, employer work sites, schools, and urgent care clinics. Capture, store, and forward exam results, or conduct an exam in real time for an immediate diagnosis. Get a quick second opinion or specialist consult. And link exam results to your patient's EHR for continuity of care and symptom tracking. In the office, Tyto Pro can be used to share images with patients to explain a diagnosis and motivate treatment. Tyto Home offers all the exam capabilities of Tyto Pro, but is designed for patient use with smart guidance technology so your patients can easily gather and send all the exam data you need for a more informed and accurate diagnosis, all from the comfort of home. Now you can extend your medical practice beyond the walls of your office to wherever your patients are, making the promise of telehealth a reality. TytoCare, your on-demand medical exam.
Good afternoon, everyone, and welcome to our free learning session entitled COVID-19 Infection Prevention and Control in the Workplace. Join us in a short time of prayer, and afterwards we will sing the Philippine National Anthem.
Lord God, we thank you that you promise to be with us always. Thank you that your presence is with us right now. Today, we give you our hearts, our minds, and our lives. Come speak your words of life into our beings. We pray that you would deepen our comprehension, broaden our thinking, and transform our understanding of what we are about to study. For you are our wise counselor, our perfect teacher, and our faithful friend. Thank you, Lord. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, telas ng sinakanan, alam ng puso, sa dikit mo'y buhay. Lupang hinirang, tuyak ka ng magiting, sa manluluping, di ka pasisigil, sa nagagang tutok sa simoy at sa langit ng bagaw, ay hinatang tulad, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nag-iindig, ang bituin at araw niya kailan ang ay di magdidinig. Lumalang araw ng walhagit pagsinta, buhay langit sa piling mo. Ang hinigaya na pagkay mga api, ang mamatay ng dahil sa'yo.
A pleasant afternoon to everyone. I am Joy Guevara from IDS Medical Philippines.
Hi everyone, I'm Cynthia Saraiba from the People Management Association of the Philippines, or PMAP, and we are your host for this afternoon.
Good afternoon, Miss Cynthia. Magandang hapon sa inyo. Kamusta po kayo, ma'am?
Hi Joy, okay naman. I'm excited for this event this afternoon.
Ako rin po, Miss Cynthia. I'm so excited because this is the first time that we are partnering with People Management Association of the Philippines, or PMAP. I would like to thank the leadership of PMAP for having us. Special shout out to Ms. Liza Mapagu for connecting us with the organization.
Yes, Joy, we're glad we also have IDS Medical Philippines as our partner for this free learning session this afternoon.
Ma'am, I will take this opportunity na rin po to thank our team here in the Philippines. I would like to thank our Managing Director and Senior Vice President, Mr. Rafael Fernando, and also our Business Unit Head of INOQ and ATS, Mr. Juancho Kaalin. And of course, ito pong aming support here, the Medical Consumables team, pati na rin ho yung IT team namin who are helping us as our support here po sa office. So maraming salamat po sa inyong lahat. So before we continue to give his welcome remarks, I would like to call on the brand and marketing manager of INOQ Business Unit, Ms. Tiffany Hong.
Thank you so much, Joy, for introducing me. Hi, good afternoon, everyone.
And first, I would like to say thank you to the officers and board of trustees of People Management Associations of the Philippines, headed by President Ellen Felindo, and to all HR practitioners and the companies represented this afternoon. And thank you for taking your time to be with us. And during this pandemic, Human Resource led our companies to be renewed focus on employees, not only their work performance, but most especially on their health and well-being. Your unwavering dedications to the employees and families of individuals who contracted the COVID-19 viruses is exceptional. idsMed Philippines is here to help the companies to protect their employees as they transition to the hybrid work setup by continuously providing trailblazing products such as respiratory care antiviral masks and zonal surface sanitizers. And lastly, I would like to say thank you to the speakers for sharing their time and expertise, and kindly allow our speakers to provide recommendations and challenge the measures we have made to prevent and control COVID-19 infection in the workplace. And again, good afternoon and enjoy the rest of the webinar.
Thank you very much, Ms. Tiffany Hong, for that message. And now at this point, I'd like to call on Ms. Bebet M. Reyes, Associate Fellow in People Management. She is the PMAP trustee in charge of the Ways and Means Committee to give her message. Ms. Bebet.
Good afternoon, everyone. On behalf of the People Management Association of the Philippines, PMAP, I would like to welcome you to this webinar entitled COVID-19 Infection Prevention and Control in the Workplace. The People Management Association of the Philippines, PMAP, is a professional, non-stock, not-for-profit organization of over 1,800 member companies and individual management executives engaged or interested in human resource management and industrial relations work. As a professional association, PMAP helps institutions mold an enlightened, competent, socially responsible, and influential sector of people managers who can effectively participate in nation building. So through this webinar, we will be able to know more about the prevention and control of the COVID-19 infection, and we can always protect our workplace, especially in this time of pandemic. And now that we can already go back to our workplace in full capacity, there is a feeling of security in our mind, and we will be confident to go back to our workplace if we know that the company is doing something for the prevention and control of COVID-19 infection. On behalf of the People Management Association of the Philippines, PMAP, we would like to thank idsMed for being a partner of PMAP. With the partnership of PMAP and idsMed, we are doing everything we can to ensure the health and well-being of our employees, other people in the workplace, and in the community. Again, thank you very much, idsMed.
Thank you very much, Ms. Bebet, for that wonderful message. Joy, alam mo ba, covered tayo ng Luzon, Visayas, and Mindanao. And we have now, as of this moment, a total of 198 may nag-sign in pa na isa. A total of 198 attendees and more are still logging in.
That's so exciting po. Very nice. Salamat, Ms. Cynthia, for that update. Thank you very much for spending your afternoon with us. So huwag po kayo mag-alala, hindi namin kayo bibigoin because our team prepared a lot of surprises for you this afternoon. Hindi lang tayo may lectures, but we also have games later on. So stay tuned. And kung may mga friends pa po kayo, please invite them to join. Once again, we would like to welcome each one of you. Hindi lang po yung mga naka-zoom in sa ating or naka-log in sa ating Zoom platform, but also to our friends who log in or who are watching us now at Facebook Live.
Yes, we are live in PMAP FB page, and I believe we're also live on InnoQ FB page. Thank you to everyone for joining us.
Ma'am, you're right. Tama po kayo. Naka-share na po ang Facebook ng PMAP dun po sa Facebook namin, sa InnoQ FB page. And speaking of InnoQ FB page, we would like to encourage everyone to follow our social media accounts. Okay, para updated po kayo sa mga special promotions and also to know more about our house brand, which is InnoQ. And also to know more about RespoCare antiviral mask. So on your screen po, naka-flash na on your screen. So Ma'am Cynthia, magpapatulong ako sa iyo dito ha. We'll encourage everyone, yung mga attendees natin, na please po, if you can scan the QR codes on your screen, it will direct you to our FB page and IG page. Tama ba? Paki-like or subscribe? Hindi yan. Sa YouTube yun eh. So just follow us or like our page para po you will be updated. And also, if you're having a hard time naman po to scan the QR code on your screen, you can just go to your FB account and look for at InnoQPH in Facebook, or you can go to your IG at InnoQ.ph naman po yung hanapin nyo. That's our IG handle.
So before I introduce our first speaker for this afternoon, let me remind everyone once again to send their questions for our speaker through the QR code that you see on the screen, no? And simply, or you can simply also type your questions on the chat box. So now at this point, I'd like to introduce our first speaker for this afternoon. He is the past president of the Philippine College of Physicians. He is a former National Task Force advisor to COVID-19. Currently, he is the chair of the Kilusang Contra COVID or Kill COVID. With 287,000 followers, dami, no? In his FB page, he considers himself as an independent health reform advocate, fighting for healthcare reforms and creating culture change initiatives among Filipinos. Ladies and gentlemen, let us all welcome Dr. Anthony Liachon.
Can I share my screen? Okay. Can you see my slides and can you hear me? Okay. Maraming salamat kay Madam Cynthia Saraiva. Good afternoon. And thank you also to Ms. Joy Guevara, the other moderator. I'd like to thank, of course, the management and executive committee, members of the People Management Association of the Philippines, plus the IDS RespoCare regional officers. Good afternoon. And my dear friends, colleagues and friends also on social media, magandang hapon po in the Philippines to our regional colleagues. Good afternoon. Well, my task for this afternoon is basically to give you an update on the COVID-19 pandemic. Where are we right now? Where do we want to go? And how do we get to our target goal? Of course, in vaccinating the country and of course, getting out of the infection. So this particular topic is very close to my heart because this is something about COVID-19 infection prevention and control in the workplace. And we consider the workplace as our second home. I mean, most of us are working more in the workplace than at home. So therefore, it's really vital that we keep ourselves healthy and strong so that we can help the economy, particularly in this time of the pandemic. So I'll be speaking together with a regional physician to talk on the latest product. But my topic for this afternoon will actually zero in on the following. I'd like to give you the current COVID situation, global and the local data. I'd like to give you a snapshot on the COVID-19 variants, focus on Omicron, and the new variants, particularly on BA.2 and the latest from Thailand, the XE. I'd like to give and refresh you with the clinical manifestation of the Delta and Omicron variant in the absence, of course, of testings, so that you will be able to address right away, particularly infection, not only at home, but also in the workplace. Vaccination program, what is the status of our vaccination program? And where are we in terms of our booster program? And I'd like to suggest a certain blueprint to address the COVID pandemic in the workplace. And what are the metrics of success? What are the best practices? And how do we empower everyone to become educated, engaged, and of course, educated in the workplace? Now, allow me to share this particular slide. This was actually done by Professor Thomas Peo from Stanford University. And I'd like to show this particular slide so that you'll be able to you'll be able to understand the different epidemic curves of the different countries. Now, on the y-axis will be the number of cases, and this is the timeline, and we will do what we call the lockdown. Now, if you do nothing in terms of suppression, the cases, particularly during those times, during the initial phase of the COVID, as well as the Delta, then you will have a steep curve. But when you start mitigation by doing all of these healthcare capacities, then you will see a downward trajectory. But of course, this particular lockdown should not be more than 8 weeks because it will cause economic depression. And once the cases are actually controlled, this is the time that we open the economy, and we call it the dance segment of the epidemic curve. So during the lockdown, you want to buy time to educate the public, you want to understand the causes, you want to recruit more manpower, you want to improve the treatment, you want to procure more testings, and of course, build healthcare capacity. Now, once you are actually in the quiescent period, like at this time, we are on the down segment of the epidemic curve, we have to keep the reproduction number below 1, and then you need to ensure the proper testing, contact tracing, quarantine, and isolation. But we should not stop at educating the public. That is very important. And we need to ban large gatherings or be careful during this particular election campaign period. We expect a lot of people going out, and mobility is an important problem. Now, while we are also in the down segment of the epidemic curve, we should not actually loosen our guard, particularly abandoning face masks and all of these safety precautions. Now, there are about 482 million confirmed cases and more than 6 million deaths reported across 200 countries. And every day, we have 1.4 million cases with almost 4,000 deaths daily. And the US, India, Brazil have seen the highest number of confirmed cases, followed by France, UK, and Germany. And only very few places have been left untouched. So as I said, almost 500 million cases since the particular start of the pandemic in January of 2020. Now, we have right now a surge in Europe, and we will discuss that later on. But let me give you a visual perspective of what's happening in Europe right now. So we have actually a quiescent period based on this, and then about a month ago, they started with this actually surge. And then with, of course, tightening up the measures again, you have a downward trajectory of France, but you have an uptick right up of about 126,000. Germany has about 98,000. UK, for a time, they abandoned all the legal restrictions, but they have an uptick right now, mainly because they're abandoning the mask. So even if you have a first world country with sophisticated healthcare system, you may have also a problem. Austria is having problem as well, Switzerland, and of course, Ireland. So these are the countries. Well, the rest of Europe, I think they're doing well, Portugal and other countries. Now, how about in Asia? Now, this is very close to our heart because this is the current scenario based on the Johns Hopkins University. Of course, South Korea was one of the model countries in the world, together with Australia, New Zealand, during the initial few months of the pandemic. But right now, it is one of the epicenters with 345,000 cases, and then followed by Vietnam at 169,000. Vietnam was also known as one of the model countries, basically on the strength of their testing and isolation. And then Japan controlled this, and then there's a downward trajectory right now, about 40,000. And Thailand for a time, and then you have Malaysia, and then you have Bhutan. But the Philippines, after suffering for 4 surges, mainly the Delta and the Omicron, we are right now in a better position. We are low risk right now, but less than 500 cases. But we're not yet out of the woods yet. And I'll tell you later on the reason why we should not be complacent and drop our guard. Right. So this is the latest data. I got this yesterday from the ASEAN WHO website. So on top of the list is actually Vietnam with 50,000 cases at this point in time with 37 deaths. And then followed by Thailand with 24,000. And then Malaysia at 12,000. And then Singapore, 3,743. And then you have Indonesia and of course the other countries. But more importantly, I'd like to emphasize that we're doing well at 276 cases and 22. But I must caution you, of course, what we might actually be underreporting because we are not reporting the rapid antigen test, though it should be reported, and perhaps what is being reported are those cases done by RT-PCR. But I work in the hospital. There's zero admission at the hospital I'm working. So I can assure you that we are actually under control and we are low risk at this point in time. Now, yesterday, from the daily reporting, we're now reporting on a weekly basis, and usually it's being done every second Monday of the month. No, so this was yesterday, and we had 2,679. That's an average of 380 cases per day. And we have the IC, one of the metrics of a strain healthcare system, if you have very full ICU. And we define high risk as 70% ICU bed utilization. So we're better right now at 16%. And then we had 329 deaths, but I think this is just backlog, this 329. And we have only 1 severe critical admissions. Now let's now go to the mutations. Like all viruses, SARS-CoV has been with us since 20 years ago, but this particular virus has been mutating. You remember the SARS-1 and the MERS-CoV, and since it's emerged in 2019, mutations actually happens in the genetic code in which the virus spike protein would actually affect the ability to infect the cells. So this is the appearance of the coronavirus, right? And you have the spike protein, you have the ball here, you have the spike protein on the electron microscope, and the spike protein is that part of the virus that enters the human cell. And there were many variants that actually came to the Philippines, from Wuhan, from the 6B1, then you have the UK, the South Africa, the Brazil, the Philippines, the India, that's the Delta, and then the Lambda. And the WHO renamed the variant according to the Greek alphabet. So that you will not stigmatize the country of origin. For example, you have Alpha from United Kingdom, you have Beta from South Africa, you have Gamma from Brazil, then India, you have the Delta. Now, the Omicron is considered to be high risk because of the spike mutations 32 as opposed to the Delta, which would only have 10 mutations. All right, so it's a highly divergent variant with a high number of mutations. Now, the Omicron evades the immunity better than the Delta. The Omicron was actually 2.7 to 3.7 times more infectious than Delta. The Delta is more ferocious, killing more persons and causing more respiratory failure, leading to intubation and ventilation and staying in the ICU, as opposed to the Omicron. But we should also consider that these patients, based on the particular study in Denmark, that nearly to 12,000 households conducted in the University of Copenhagen, 78% of Danes have been fully vaccinated, while nearly 48% of those received third boosted shot, and yet they actually evade the immunity better than the Delta. And this is a nice summary by Dr. Eric Topol. Dr. Eric Topol is one of the top 5 researchers in the world, not only in cardiovascular care, but in any subject matter. And I'd like to summarize the good news and the bad news regarding the Omicron. In terms of transmission, good news is that we know how to reduce by mitigation measure using masks, medical grade, distancing, ventilation, and air filtration. So what is bad is actually it doubles every 2 to 3 days, and it is highly transmissible and threefold to about 5 times than the Delta variant. Now, one of the main characteristics of a variant is its ability to render some vaccines ineffective. And that's why you need a booster shot, let's say for Omicron and the other variant, because it will drop to negative 35% with only 2 doses. In terms of illness and severity, Omicron is described as less ferocious and therefore less hospitalization as compared with the Delta. But because it's highly transmissible, you can have a lot of cases and therefore render the workplace and the workforce and the manpower less productive, because even if you are, I would say, not admissible in the hospital, you will still have to report, and therefore you will be less productive in the workplace. The other one is about immune escape. It's blunted by a third shot, therefore a booster is important. And then reinfection, it's still possible with either a Delta or an Omicron. And the problem here is the occurrence of the long COVID syndrome. Now, this one is a nice slide on, this is from the New York Times, and data would say that the Omicron spares the lungs. And this is a nice representation, a picture of the Omicron. Usually a person will present with headache, fever, and then runny nose, and then you have a raspy sore throat, and then cough, and then general body pains and fatigue. But generally, you will actually, that would spare also the lungs. Now, patients with Delta will have the same symptoms, same as the Omicron, with fever, loss of smell or taste, or runny nose, but they will have severe acute respiratory syndrome and present with shortness of breath. And these are the patients who would go to the hospital. If you remember, last year, from June to December, we had a very strained healthcare system. And most of the patients then were admitted in the ICU and intubated. So we are right now, in this country, we have 80 to 95% Omicron cases. We see a handful of few cases of Delta variant, but this would be the presentation of patients with Omicron. Now, this one is a nice study from UK describing the most common symptoms related to Omicron as opposed to the Delta. The most common symptom referable to the Omicron is actually sore throat, then fever, cough, and then you can actually have diarrhea and then muscle pain. But for Delta, there's a preponderance of patients with loss of smell or taste. All right, you can have red or irritated eye, sneezing, and then of course shortness of breath. All right, so this is the clinical manifestation of Omicron and the Delta variant. Now, they would say Omicron is a mild disease, but it is actually a Trojan horse, because many vaccinologists would say that even if you have a mild case of Omicron, it would lead to other problems. We should, according to Dr. Anthony Fauci, the advisor to 6 presidents and currently to President Joe Biden, there's no evidence that there's no difference between the Delta, Beta, and now the Omicron. We should always be aware that when people get symptomatic, anywhere from 10 to 30% people will go on to have persistence of symptoms, even with mild cases. And patients would present with symptoms like shortness of breath, you have fatigue, difficulty concentrating, insomnia, and brain fog. And this one is a nice representation coming from the New York Times. And they would present either with some neuropsychiatric symptoms like anxiety, depression, insomnia. Some patients would present with impaired attention, concentration, and memory. Some would have persistent sore throat and dry cough. Others would present with chest pain, palpitation, and difficulty of breathing. Some would have shortness of breath, breathlessness, and of course, some other symptoms. And this would last, this would actually be persistent even months after the COVID has disappeared or has been treated. So this is one of the main problems that we see in patients with long COVID. So whether you have the severe Delta type or the or the Omicron, the problem is actually the occurrence of the long COVID syndrome. And this will actually cause productivity problem. In UK, there was a report of decreased productivity when about 1/3 of their employees would not report to work because of the presence of symptoms of the long COVID. Now, the surge in Europe, according to Dr. Eric Topol, is a combination of three factors. The first is the occurrence of the BA.2, all right, which is more transmissible than the other subvariant BA.1 of the Omicron. The other is the waning immunity of the booster. According to the CDC, with the third shot or the booster, you will reduce your immunity in 3 to 6 months. And that was the impetus or trigger for the US FDA approval for the 4th dose in a study in Israel. And the other one, of course, is the cavalier attitude of some countries to ditch off the mask and, of course, all the protective measures related to protect them from the virus. Now, this one was a report just yesterday. The BA.2 is now the dominant variant in every region in the United States and accounts for 72% overall of the new COVID cases. We had our BA.2 last December, January, but with the waning immunity right now with the vaccines, I suppose just in case it would actually travel back to the Philippines because of the loosening up of the border control, then we might have actually of a resurgence of the BA.2. So we need to understand that in other countries, they started very slow, and then right now it's 72% of all the variants of the new COVID cases in America. Now, 2 days ago, the Department of Health reported an Omicron XE. An Omicron XE is actually a combination of BA.1 and BA.2. So it was first reported in UK. It was first reported in UK. It's a recombinant or a combination of BA.1 and BA.2. First reported in the United Kingdom in January. And then in Thailand. In close coordination with the Department of Health, the WHO said that this is not a variant of concern. But while the early day estimates would indicate a 10% growth or 10% more transmissibility, the World Health Organization says it's still part of the Omicron variant unless a stark difference in transmission and the disease severity is shown. So variant is usually graded on the following features. One, the severity of the presentation, whether you have pulmonary presentation. Number two, the transmissibility. And number three, whether you would render a certain vaccine ineffective. At this point in time, right, Omicron XE is not yet a variant of concern. Now, I'd like to focus your attention to this particular date, March 29, because of the threat of the BA.2. The BA.2 um, in the United States, the coronavirus, the FDA authorizes a second booster, meaning to say a fourth dose, a dose of 2 COVID-19 vaccines as a primary vaccine for older and immunocompromised individuals, meaning to say 50 years old in immunocompromised individuals, and for Moderna, 18 years older, and for Pfizer, 12 years older. Now, but we should actually not abandon, of course, the 4 pillars to control the COVID-19. And here we can see that we need to understand the testing. Number one, who is infected? We need to understand this. We need to trace who are those in contact with the patients. And those who are positive, we need to isolate them. And of course, those patients also quarantined, we should actually prevent the contacts from infecting others. I think we need to, empower every Filipino citizen to understand the 4 pillars to control the COVID-19 test. It should be a way of life in terms of understanding on how to control the COVID-19 at home and in the workplace. Of course, there are 2 tests that we're using right now. Of course, the RT-PCR is considered the gold standard. It's quite pricey. It's about 4,000 pesos. So basically, it's quite expensive and prohibitive, and results will actually be available in 24 hours or even shorter. But the rapid antigen is basically used to tell us whether a certain person is infectious or not, and a good screening tool for COVID-19. And the results will actually be out in about 15 minutes to 30 minutes, just like a pregnancy test. And of course, this is the appearance of a positive test. You have 2 lines here. You have the control and you have the test. This is a negative test. And here you have a positive test. So basically, you have a lot of rapid antigen test kits in the market. And we have the Abbott, we have the Longen, but basically it's very easy to do. And we've been using this since I'm going out most of the time. And, we have 5 doctors in the family. So we want to protect, of course, the unvaccinated persons in. And that's my apo. That's my granddaughter, Simi. So we would like to, be vigilant regarding this particular virus. Now, this one is an important slide so that you will know when is the rapid antigen test. Usually, it's detectable in the first 5 days. And even when you do the RT-PCR, it can still be positive because of the residual skeletal fragments. And therefore, when you do the PCR, it can still be positive even after 14 days or even in 3 months. What is important is the rapid antigen test, because this is the time, the first 5 days, that you can have the high viral load. And this has been the standard that we're using right now because it is easily used, it is actually accessible, and it's actually cheap. And this has been considered as well by the Department of Health in terms of clearing patients for work, aside from the RT-PCR. Of course, we should not forget this wonderful slide. This is the Swiss cheese infographic by Ian McKay from Australia. We have our personal responsibilities of keeping, of course, ourselves, social distancing, masking, and all the hygiene. And then we have shared responsibilities with the government in terms of testing, in keeping our house, our homes, and of course, our workplace properly ventilated. And of course, we need to do good messaging, not only for the government, but also for the workplace. And we need to master, of course, the healthcare capacities. And the last one in this particular slide is, of course, the vaccine. Now, take note that it is not a perfect world. Each intervention has imperfection, and that is represented by the host. But each one is additive, and everything, the multiple layers, would improve the success in terms of preventing the spread of the COVID infection. Now, what is important right now with the vaccine is actually to protect us from severe disease and protect us from hospitalization. But it doesn't mean that even if you're vaccinated right now, you will not actually contract the virus. Of course, you can, because we call it the breakthrough infection. And we need to redefine right now the doses later on, whether it's 2 doses or 3 doses, because of the waning immunity of the vaccines with the advent of the variants. Now, this one is a beautiful study from Israel, where the US FDA got this particular approval. Last year, sometime in July, to be exact, one day before my birthday, July 29, there was this particular study that they actually recognized that unvaccinated individuals will have increase in the number of deaths. And then with 2 shots, you have a decrease in the number of deaths. But lo and behold, with 3 shots, they have very significant number of deaths. In fact, almost no deaths at all, or even if it's actually negligible. So this led, of course, to the conclusion that the Omicron doses for protection should actually be 3. So this was the trigger right now to say that the complete vaccination is not actually 2 doses, but actually 3 doses. And this was actually supplemented or strengthened by the position of the CDC. And as you can see here, on the first dose, less than 6 months after 2 dose, it would decrease to 76% 6 months after the dose. But when you give a booster for the Delta, it would increase to 94%. More so with the Omicron, as you can see here, from 52% first dose to the second dose, 38%. Then with a booster, you will increase it to 82%. And this has also been the study in terms of the hospitalization, that the third dose would actually increase the level of immunity to protect us from hospitalization. And there's no doubt about that vulnerable groups vaccinated, and once you have booster, you have a tremendous reduction of Omicron cases. And this has been proven. And I think we should understand this so that we can encourage more people to be vaccinated. Now, our current vaccine population with 2 doses is about 65% nationally. But the herd immunity for variant has been increased to 90% to protect us. And this is just today in Twitter, and this is from the Department of Health. As of yesterday, around 66 million individuals are fully vaccinated, meaning to say 2 doses. And the Department of Health said that only 12 million people already received the booster. That's quite low, considering these persons, these individuals, you don't have problems here of vaccine hesitancy because they were able to accept that. So therefore, it would be easy for the Department of Health and of course the workplace colleagues or the human resource to actually influence these guys to be protected and have the booster. And the Department of Health called on the 47 million eligible individuals to get vaccination. The problem is that my diagnosis is that during the last quarter of last year, we have a mega vaccination. Remember the 15 million vaccination last December, and then we had the Omicron, but we were able to parry that, and then we have a very low number of cases since that time. It is because of the hybrid immunity, meaning to say we develop immunity naturally from the Omicron because we were the first country to be attacked by the BA.2. And then we have huge vaccination effort last December. Now, my prediction is that we are still okay because we're actually on the 3rd month after the mega vaccination, but we will have waning immunity in the next 3 months, that's 6 months, based on the projection by the US FDA and the CDC. Now, since we have around 50 to 60%, our target should be around 90%. And herd immunity would prevent viral transmission. So if you are in this particular area, this is the infected persons, we need to, ramp up the vaccination so that we increase the number of vaccinated individuals. I think this should be our target, to get 90% of our people vaccinated. Now, since I work for disclosure purposes, I used to work with Pfizer for 2 decades, and I think it's important to note that last August 23, Pfizer has been granted the full certificate approval from the emergency use authorization. And what does the shift from EUA to full FDA approval? It means you can actually commercialize. It will be available in drugstores. It will be available in the clinics of doctors, and this would actually fast track the vaccination and, of course, enhance the public-private partnership. So what's happening right now in our countries that we have a bottleneck situation in which you have, thousands of people or hundreds of people piling up to be vaccinated, no? Pila-pila ho tayo. Rather than a situation is something like in the United States that you can actually walk in to this particular drugstore, you say Walmart or Walgreens or CVS, and you have a lot of vaccination areas so that you can fast track the vaccination processes. And you have to involve the medical community, you have to involve the workplace, you have to involve everybody. It's not just the government doing the vaccination, because this should be a collective effort of both the public and the private sector. Now, last March 29, the CDC recommended 4th Pfizer and Moderna doses for people age 50. So I'd like to stress the following important points. The Food and Drug Administration authorized the 4th Pfizer and Moderna dose for people age 50 and older. So what I was thinking is that you have the 3 doses and the 4th dose should be the booster. The CDC quickly backed up the decision allowing the shots to be administered, and the FDA and the CDC made its decision even without consulting the committees of independent vaccine experts, because this is a straightforward decision considering the threat or the onslaught of BA.2 in the United States, considering they have opened the economy. And BA.2 has gained ground in the US since February and expected to become the dominant variant here in the coming weeks. So here in the Philippines and the rest of Southeast Asia, knowing that still we're reeling right now from the effects of the BA.2 in South Korea and other countries, then I think we need to have a sense of urgency in trying to manage this, of course, in the workplace as well. Now, a very sad, just 2 days ago, we received this information coming from the Presidential Advisor for Entrepreneurship, Mr. Joey Concepcion. I respect the man very much, and he said that, this is about 13 billion vaccines, and we need to fast track the vaccination and, of course, the booster. And it's a lot of money. It's taxpayers' money. Our debt is about 12 trillion, and we need, to find ways, to use these vaccines, particularly in the workplace, in the school. And then we need to do this collectively. I think a summit should be called so that these particular vaccines will not be put to waste. Now, according to Secretary Duque, for our regional colleagues, kung kailan may COVID surge, saka time bakuna. Ngayon habang tahimik at konti ang pila, pinakamagandang pagkakataon magpa-booster. Means to say, we should not actually do the vaccination during the time, during the rainy season, or perhaps in June or July. Now that we are in the quiescent period and we have low number of cases, now is the time to do the vaccination. And I completely agree with the Secretary that we should do the vaccination during this time when the cases are down, when you have, a lot of mobility issues because of the local election campaign. And, this is leadership by example. Joe Biden, last March 30, received the second COVID booster as he pleads for Congress for funding, knowing that the BA.2 problem is looming in the horizon. So in our country, we have an abundance of vaccine. All we need to do is just execute together with the private sector. And I posted this on Twitter yesterday. I think we need to redefine the full vaccination as 3 doses based on the CDC and based on the US FDA. Then announce the 4th dose as the booster shot. And you will accomplish 2 goals here. You want to prevent the wastage of the 27 million vaccine doses worth 13.5 billion. And then you ramp up the vaccination and the booster program. And that was by tweet last night. And I think it should be done considering there's a lot of money and we will be able to achieve a lot of things moving forward. Now, going down to my last few slides, I think this is important. These are the criteria of the WHO in terms of lifting the COVID restriction. Is the viral transmission controlled? Yes. Are the healthcare capacities in place to detect, test, and isolate? Yes. Are the outbreak rates controlled in hospitals? Yes, I work in the hospital. 0 admissions at this point in time. But are the preventive measures in place in the workplace? Yes, but we need to do more so that we don't infect the workplace. How about the schools? We have a very low number of vaccination in the schools. And we need to do that because I don't think we have a successful environment if the kids cannot go to school. Right. And the other one is importation risk. Now that we have opened our shores to a lot of tourists, but we should actually put on the medical safeguards because variants can only be coming from, of course, international travelers. And the last one, I cannot overemphasize that communities should be fully educated, engaged, and empowered to adjust to the new norm. I mean, this is coming from the World Health Organization. You know, the pandemic is not yet over. It may not be over the next few months, I tell you. And the reason is clear. We are seeing many surges in the Western Pacific region, not only in Asia, but also in Europe and other countries. We have seen high surges in Japan, Malaysia, Korea, Thailand. So when we have these surges, there's always a chance that we may have new variant of concern that may actually come to the Philippines. And I think as Filipinos and as leaders, we have to have ruthless consistency. Ruthless consistency, I love this book because this is the way that we have to do it. We need leaders right now in every sector of society with the right commitment. We need to develop the right focus. We need to create the right environment, and we must have a team so that we can actually execute the strategy, implement the change, and build organization that would really win for the country. And, you know, my hope in the last 35 days before election, and we'll have a new president by May 9th, of course, we need to emphasize that we need to improve the ventilation in the workplace, subsidize the testing for essential workers, you know, come up with a contact tracing app and increase the internet access. And of course, create a network of healthcare facilities from the barangay to the tertiary hospitals, and to prevent brain drain. We're the #1 exporter of nurses next in the world. The second exporter of doctors, second to India, because of the lack of opportunities in our country. Sad to say, but this is the sad reality. They are overburdened, they're overstressed, but they are underpaid and perhaps underappreciated. We need to provide timely and complete case data. We need to provide clear and consistent messaging. We need to improve on the mass transportation. And we need to have a vaccination process that is transparent, simple, agile, and provide economic stimulus in case of lockdown scenario. Now, in the workplace, we need to, you know, talk with our engineering partners, our, architecture colleagues, so that we can actually have an environment that would be conducive to working. We need good ventilation. We need open windows, ceiling fan, all these filters and all. You know, we need this particular situation, and we need to protect our people by having good ventilation. Now, this one is a template used by the WHO. We need to improve on vaccination. You need the third dose as well as the fourth dose. We need to increase the mask use, the ventilation of closed spaces, and the use of clinical treatment protocol. Now, I cannot overemphasize that we need also to provide, of course, a very nice protection, of course, for our colleagues. And I've been using this particular mask when going to the hospital, and it has protected me. I have not contracted a COVID for the last 2 years, and I've been using this. Of course, the recommended is an N95, a K95, and a KN94. I think you need to use that. You need, because I think the next speaker will talk about the antiviral technology. I think I would like to leave it to the expert, but I've been using this for almost 5 or 6 months now. And I have this sanitizer with me. Very nice surface sanitizer that is long lasting. The next speaker will try to elucidate further later on. But going to the last slide. This was issued by the New York Times that a new wave of COVID-19 is coming. And there are 7 steps that you can actually use to minimize the disruption in your family's life. I will actually share these slides with you through Joy and of course through Cynthia, so that you can have this and then cascade this in the workplace. And these are the 7 ways you can lower your risk according to the studies done by Eric Topol and the rest. 1, pay attention to COVID indicators in your community. So you need to read the website, and that's the reason why I actually ask for, daily monitoring. Number 2 is a high quality mask on hand. Very, very important. Order home COVID test sooner rather than later. Get a booster shot when you're eligible. Get a pulse oximeter, right? And then make a plan for antiviral drug treatment. You have molnupiravir and Paxlovid, and have backup plans for social events and travel. The economy will never recover as long as the virus is not controlled. Now, I'm sorry, this is an elephant in the room syndrome. If you don't understand that, then we are part of the problem. This is a nice book that I'd like to share. This is a 2017 edition of the Leadership Challenge. And I think we need leaders in every sector of the society. And they interviewed 100,000 CEOs and leaders. And from 1987 to 2017, they came up with a question. What are the most important attributes of a leader that you will have? Because it's important to control the pandemic and lead the country after the May 19th. And the answers on the board are the following. The first is integrity, honesty. The second is about competence. The third is inspiring. And the last one is a visionary or forward-looking. And this has been asked not only in the workplace, but among the most admired leaders around the world. And it has been ranked even in the first world country. So, as a citizen, I think this is a book that I actually, one of my favorite books. This is from Clayton Christensen. Clayton Christensen dispersed to leukemia about 7 months ago. He was from Harvard, a teacher of management. And this is a book that I'd like you to read. And, day to day, I always ask this question on how I could be able to help a lot of people. I think about the metric by which your life will be judged and make a resolution to live every day so that at the end, your life will be judged as success. I just want to offer this as a final takeaway from at least what I'm thinking about. And this particular thought would actually mean so much to me, knowing that we are in a situation, unprecedented in our history. And that is really important. I hope that you succeed at what you're doing, but it doesn't going to be the measure of your life. You know, God doesn't count and he doesn't aggregate. And that is just going to assess you on the basis on how well you help other people be better people. And well, God bless everyone in this particular symposium. And I hope that some of these ideas will be helpful to you and your organization, and that you will be successful in the way that God will measure your success. So maraming salamat and thank you very much.
Thank you, Doc Tony Lechon, for that. Hindi lang po siya informative session, but it's also inspiring session. Salamat po for being consistent in providing relevant information about the pandemic and for sharing your recommendations to help us keep our work environment safe. Alam niyo po, si Dr. Tony is very consistent po yan sa Facebook Live every night. So kapag po meron kayong time, puntahan niyo lang po yung kanyang Facebook page and you will see him very consistent, sharing his knowledge, sharing new information about this COVID-19. Pero, so kung nabitin po kayo, don't worry because Dr. Tony will come back for the Q&A later. Okay? So before I turn over the floor to our next speaker, please focus your attention on your screen.
Hi, my name is Dr. Harshan Lech and I'm a doctor with the Emergency and Trauma Department with 13 years of practice. As a clinician, we meet many patients in a day and we have no idea who may be a carrier of diseases. Hence, it is important for us that we protect ourselves, and one of the ways that we do that is by wearing a good mask. With the current COVID pandemic, one is even advised to double mask. However, double masking and today's masks available in the market comes with its own limitation and challenges. It is also difficult to breathe in some of these masks, especially with double mask and N95. We also tend to touch our face very often in a day, and this results in a risk of cross-contamination every time we touch our masks. The current masks that are available in the market are recommended to be changed every 4 hours. But how many of us really do that? And that is why I really like RespoCare, the first and only FDA-cleared antiviral mask that has been designed with strong scientific evidence and certification. Unlike the other masks in the market where there is risk of contamination on the surface, the risk for a RespoCare mask is significantly reduced. The RespoCare mask is unique. The 4-layer design of the mask features an outer layer which traps and absorbs infected droplets to reduce the chance of cross-contamination if touched. It comes with a patented Virex technology, which is able to kill 99.99% of viruses. It is also certified with ASTM Level 3, which is the highest standard available for masks. The mask is currently available in 3 different versions: the N95, the adult flat mask, and the children flat mask. So who should use this mask? I definitely would recommend all the frontline healthcare workers who meet patients regularly. Anyone whose jobs requires to meet people frequently, and anyone who is seeking for better protection for themselves and for their loved ones. The RespoCare mask is my choice because to me, nothing is more important than health, and as a clinician, it gives me great comfort and confidence to continue what I do on a daily basis, knowing that I am protected by science. RespoCare, protecting you with science.
Our next speaker is part of IDS Medical Regional Team. He has part-time affiliations with Glen Eagles Hospital as an emergency registrar. He is the director of InnoQ APS and Digital Health Solutions. Let us all warmly welcome Dr. Harshan Lech.
Good afternoon, everyone. Thank you very much, Joy, for the short introduction, and thank you very much PMAP for inviting me for this Facebook Live webinar. I'd like to share my screen here. Okay. Also, I'd like to thank Dr. Tony for that insightful COVID-19 update on the Philippines, and also the inspiring notes that you spoke about concerning life. And, you know, I guess this whole pandemic gives us some form of perspective as to how we'd like to live our lives. Yeah, what are the important things that matter? Right. So I'd like to get right down to it. Thank you very much, Joy, for playing the video. For those who seem to think that it's a different person, it is indeed the same person. Yep. I look a little bit different on FB Live, I suppose. Okay. So getting right down to it, Dr. Tony was speaking about what needs to be done for COVID-19, for you to be safe, for your loved ones to be safe during COVID-19. And he touched upon the need for an additional booster. How do you practice being a safe protocol in the workplace? And one of those practices that are very, very important for you to incorporate, that if you already have not, is wearing a mask. Yeah, I think at this time now, everyone is very familiar with the different types of masks that are available in the market. But let's just go through this for everyone's general knowledge, so we have a better understanding of how you differentiate the different masks that are available in the market. The most common and the most simplest one will be cloth masks. Yeah, they offer the lowest form of protection, and these are the ones that you see available on very easily in the retail outset. Yeah, in the malls, in the shopping centers, you'll be able to get these masks, and they are basically made from a mix of cotton and also PPV as well. The other one that we are most commonly using, that you see everyone using in a daily setting, would be the surgical mask. Yeah, it's known as surgical mask because surgeons also use it in the OR setting, but it is not a specialized mask in a sense that it is not a respirator. Now, the respirator that you see on the right side is a very specific mask that healthcare workers will use in very highly infective conditions. And I wouldn't recommend all respirators, I wouldn't recommend everyone going to a regular job, doing regular things like grocery shopping, or going to the mall to use respirators, because over a long period of time, they can be fairly uncomfortable, and you also need to check in a healthcare setting whether you have a proper fit for a particular respirator. So respirators are generally used for healthcare personnel. And you would also see respirators below with the child with the valve. Yeah, if you see respirators with these valves, especially with exhalational valves here, these are not meant for COVID use or usage in an infectious environment. Yeah, the exhalation valves are actually meant for construction workers to be able to keep dust out, but they still get air into their airway. Yep, so this is not suitable for everyday use as well. And of course, I think with elastometric masks and the respirators, you wouldn't want to be using something like this on a daily basis. Yeah, it'd be probably out of a movie set if you're planning to do so. And they are fairly expensive as well. So having said that, this does not identify as a mask. Yeah, this is a bandana that you would see some people using. Yeah, this is not something that we would consider a mask. Okay, now RespoCare masks, we have two currently available. We also have the other anti-allergy and also the anti-allergy and yes, the anti-allergy and the child mask. But today we'll be focusing on the antiviral mask here, that we will be talking about in terms of the science and what are the features of this mask. The N95 respirator, as I explained, is used or recommended for use for only healthcare personnel. What is special about RespoCare? So RespoCare as a mask, if you do not already know, the mask has been out since 2013. Yeah, there have been 7 years of clinical research that have been done in the mask to be able to give us our FDA rating, and also due to our patented Virex technology. Now, if you look at the mask, if you're familiar with the mask, you will notice that the mask is slightly thicker than the average surgical mask. Why is this so? There are 4 different layers in the mask and each layer has a specific function. Yeah, so we'll be going into the science of it, yeah, trying to understand what these different layers are and how do they protect you, me, and your loved ones from viruses. The first and outer layer is known as the hydrophilic coating. Yeah, the first and outer layer you're talking about is the layer that is exposed to the external environment. And this layer is very, very special because it has a coating that allows droplets to be wicked in and stuck onto the mask so that they can be killed. The second layer is the patented Virex technology that we have in the mask that actively kill the viruses once they are stuck onto the first layer. So we'll be going into the details of how this works in the next slide. The third layer is basically polypropylene for particulate filtration. So it acts as a filter and also fluid resistance from anything that you are breathing in. And finally, the inner layer is polypropylene for comfort when it is in contact, when the inner layer of the mask is in contact with your face. Now, how does RespoCare kill viruses? Yeah. There are a few steps. We will just go through this in a very simplistic manner for everyone to understand. The infected droplet containing the virus will latch onto the external layer of the mask as you are walking around. Yeah, so it gets onto the external layer of the mask, and as I mentioned, this external layer of the mask is very special. Yeah, so COVID, of course, there's a little bit of a difference between whether COVID is aerosol or whether COVID is a droplet infection, but essentially they work in the same way. So this molecule of virus will attach itself as you're walking. If it's out in the atmosphere, it will touch the outer layer of the mask. Now, the outer layer of the mask, because it is hydrophilic, that means it absorbs water, it traps the virus in the outer layer of the mask. Yeah. And once the outer layer of the virus is in the outer layer of the mask, it is trapped and brought in. The second Virex technology layer is the layer that actively kills the mask. How does it actively kill the mask? It has a few properties. Number one, it has a low pH or acidic environment that denatures the virus and the surface membrane of these viruses, and this can start to occur within 5 seconds. The second thing that happens is it contains copper and zinc ions as well that disintegrate the virus as the virus is stuck in that layer. So because of this nature that it can detect and bind with these viruses and kill them, the Virex layer essentially mimics the surface of a living cell in our bodies. Yeah, and those living cells contain sialic acid. Yeah, the virus binds to these sialic acid receptors, and because it's trapped in this layer and it's exposed to these concentrations of copper and zinc, it destroys the viruses and its interaction with its proteins for RNA or DNA, depending on the type of virus. So RespoCare is not specific just for COVID. Yeah, it has essentially been tested with a wide array of viruses, which we'll be going into some detail later on. Okay, now this slide basically shows you how the RespoCare mask differs with an ordinary surgical mask. Now, if you see on the first left, the left corner of the screen, on 0 second, you see there's a droplet that has been placed onto the normal surgical mask. After 10 minutes, you still see the droplet there. If you look at the RespoCare mask, from the first time that the droplet was put onto the outer layer of the mask, within 5 seconds, this droplet is absorbed, and within 10 minutes, you can hardly see it. Yeah. So this essentially allows the mask to actively fight viruses as you are walking around doing your daily work, going to the groceries, picking the kids up from school. So this mask actively kills the viruses as you're going about your daily job. Now, I spoke about a little bit on the array of viruses that this mask has been tested on. Yeah. So RespoCare was not created just because of COVID. Yeah. It has undergone 7 years of specific research and development to come up with this patented technology. And we were also one of the first ones who are FDA approved for antiviral technology. Now, this is a slide showing you the array of viruses that the RespoCare mask has been tested against. Yeah, these are highlighted here because these are influenza virus strains. Yeah, some of the most infectious viruses that you will see, and you would notice that the viruses are destroyed anywhere from 1 minute to 5 minutes upon contact with the mask. Now, the other interesting thing about RespoCare is we have done several laboratory tests to understand how long is it safe to use the mask. Yeah, and it has been proven through these studies that we can effectively destroy 99.99% of viruses over a continuous 8-hour period. So it's not 99.9, it's not 99, it's 99.99%. Yeah. It is also shown to be very, very safe. Yeah, the patented combination for the Virex layer uses food additives that have already been proven to be safe and effective. Yeah, the mask has also been tested for compatibility with skin, and it's also noted to be safe under the ISO 10993. The mask does have a mild scent though, and if you notice the scent, you would notice it's very similar to white vinegar because it actually contains acetic acid as part of the coating process. Yeah. And if you're a little bit worried about breathability, some people are a little bit more congested with allergic rhinitis, a little bit more sensitive in the nose. Don't worry, because this mask has been specially designed to be very breathable as well. Yeah, so it achieves low airflow resistance. Yeah, through the specific design of the mask. Now, what kind of standard does this mask meet? Yeah, we would go. There are different standards all over the world, but I think there's one international standard that everyone generally tries to meet, is known as the ASTM standards, which stands for the American Society of Testing and Materials. Now, there are three different levels for ASTM, where they characterize the levels based on the efficiency of filtration of the mask in entering the patient's airway. And RespoCare achieves level 3 barrier, which is the highest barrier under ASTM levels. Okay, this is a slide to show you where you can find our FDA registration and clearance in the FDA website. We will share some of this information with you after the presentation. This is also our NIOSH approved respirator for healthcare services. And this is my last slide. So lastly, if there is too much science in this presentation, I think simply put, it is very, very important to remember, if you remember nothing else, that with RespoCare, defense also means offense. Yeah, what do I mean by this? Do you just want a mask that is going to be shielding you from viruses? Or do you want a mask that will actively kill these viruses while you're going about your day-to-day work? So if you want to really remember it very simply, just picture this. Captain America with just his shield. Would you rather this? Or would you rather this? Captain America with the shield and Thor's hammer. Okay, with that, I'd like to thank you very much for your time, and I hope this session was informative. Thank you.
Okay, thank you, Dr. Harshant, for a very informative session. I hope everyone listened because later on we will be having a short quiz wherein you can win prizes care of RescuCare. So before we proceed to our Q&A, we have prepared 3 surprises for everyone who are present here in this webinar. So first, I call this a simple live selling session. I'm sure most of you are aware of this and probably experience kung paano makipag-unahan mag-mine, right? So this time, hindi nyo siya kailangan gawin because all of you will be given a chance. So I'll just show you something. Okay, so what I have here with me is our RescuCare antiviral mask box of 24. Okay, so I think meron lang tayong... Okay, so can you see it, guys? Okay, so for you to appreciate it more, I will unbox this sample. So as you can see, there is 24 pieces of individually wrapped face mask. Okay, sorry, hinahanap lang po natin yung view para makita niya yung loob. Okay, hold on. Makikita ba? Okay, anyway, okay, so inside this box, it includes 24 pieces of individually wrapped RescuCare antiviral mask. So inside, let's put out something. This is actually my personal box. So bawas na siya. I'll just show you in the individual wrap. So see, naka-plastic po siya with silica bag inside. And also, some of you pwedeng maging concern is the expiration date of each mask. So kapag na-receive niyo, if you order this, meron siyang, sorry ha, I'm not sure if nakikita ninyo. Ayan. Okay, so diba live selling na tayo? Ayan, so meron siyang printed expiration date sa lahat po ng plastic na makikita ninyo. Okay, so if you listened earlier with from Dr. Harshan, he described the 4 layers of the mask. So again, I'll just reiterate, the outer layer traps and kills the virus. The antiviral layer or the second layer inactivates the virus. The third layer is the barrier layer or the filtration. And the inner layer, yung pinakamalapit sa bibig niyo, it's the final barrier. Okay. Now, you don't have to worry pala if you are bringing extra of this mask because since naka-plastic na nga po siya, hindi nyo na worry yung madudumihan siya. You can even fold it, put it in your bag or your purse, and then also, this is available from our shops online. So I want you to grab your phones and open the Shopee and Lazada apps. So find our store, idsMed PH there. So available yung QR codes in your screen. So kindly follow us. Now, if you check our products, you will find that this box I am showing you costs 1,649 pesos on a regular price. But for today, okay, for today, you can get this as low as 500 pesos. Okay, so for 500 pesos, it's 30% discount. So here's the catch. The first 100 to order gets it at 500 pesos, and the second set of 100 orders will get it at 550 pesos, and the rest can buy it at 600 pesos. So usually, when we are on sale from Shopee and Lazada, you can only get it at 10%. So kung ako sa inyo, grab this opportunity now because this promo will only last until 12 midnight today. Okay, so 12 midnight today. Again, it's only for 500 for the first 100 orders, and then 550 for the second 100 orders, and the rest, yung mga last orders na, can buy it at 600 pesos. So all you have to do when you order, click on the Q&A button. Para private po yung mga details ninyo, Q&A button, only the panelists can see that. So type in your name, your number, and the quantity of your order. So later, someone will contact you to get your complete address. Another option is to take a screenshot of this box. Okay, ibalik ko lang po ha. Okay, so all you have to do is take a screenshot. I'm not sure kung makikita ninyo. Let's see first. Ay, baliktad pala. Sorry. Okay.
Screenshot na lang.
Kikita ba? Ayan. Okay. So, hindi.
Screenshot na lang kaya.
It adds to that. Tama ba? Wait lang. I'm getting the right view para ma-screenshot ninyo. Okay, there. So, I'm not gonna move anymore. Take a screenshot now. Di ba sa live selling, we count. So, 5, 4, 3, 2, 1. Okay, and then send the picture to our Viber number. It's 09777-158-158. Provide the same details. That's your name, your contact number, and the quantity of your orders. Okay? Ayan. So, hindi ko po tatanggapin yung pangit ako sa picture ha. So, please, paki-screenshot na lang po ng maayos. Okay? By the way, you can also share this. Ito pala, tama pala. Okay. So, you can also share this to your friends, your colleagues, and families who are not here today. So, they can also order. Okay? Are we good with taking the photo? Okay, so para mas ganahan pa kayo, for the first 5 orders that we will be receiving today with this box of 24's antiviral mask, I will include 2 pieces of AV mask or antiviral mask. In total, so you will get 24 pieces na agad. How amazing is that? So this is how it would look like. Okay, so ito po yung freebie nila. Okay, ayan. So this is the 2 freebies that I will include in your parcel when you receive it once you order the antiviral mask of 24. Again, this is for the first 5 orders, or only the first 5 orders. Okay? Okay, so gusto niyo pa paggandahan or dagdagan? Okay, stay with us until later because I have 2 more surprises for you. Okay, I think some questions are coming in from the chat box. We will entertain that in a few minutes. Okay? All right, so now, I hope you are sending your orders already to our Viber. I am seeing orders coming in. So again, first 100 would get it at 500 pesos only. Okay, so I think we only have 216 attendees right now. So lahat kayo, maximum at least 550 pesos kaya ng bilhin. Okay, now let's proceed to our Q&A portion. Okay, as mentioned earlier, you can click the Q&A button and type your questions or scan the QR code that you see on your screen. Okay, so we have allotted 15 minutes for this, so keep your questions coming. We will try to answer them all. I believe the questions that will not be answered today will be sent to our speakers, and we will provide the answers directly to your email addresses. So I hope you provided the correct email address when you registered this in this session. Okay, so Miss Cynthia, should we start with the Q&A portion?
Okay, we have a lot of questions here in the chat box.
Yes, ma'am.
Let's start off with this question for Dr. Liachon. The question is, can we mandate regularly scheduled antigen testing on the employees, even if they are fully vaccinated and boosted already?
Okay. I'm a law-abiding citizen and I always follow the guidelines of the IATF. I think every HR organization has their own rules as well. They can do it on a weekly basis or every 2 weeks, right? So as part of the organization, so we must actually be compliant. Because the scientific explanation is what we call the breakthrough infections, that even if you are fully vaccinated. Actually, the full vaccination should also be corrected. It's not actually 2 vaccinations, but actually 3 vaccinations based on the CDC guidance and of course the study. But even if you have, 3 vaccinations, you know that immunity can actually wane with time and also depends upon your body mechanisms or defense mechanism. So you just need to follow the workplace guidelines, and we need to abide it because it's under the IATF guidelines as well as the Department of Health guidelines. Personally, I usually do it also on a weekly basis because I work it in the hospital or whenever I have symptoms. Let's say influenza-like symptoms, because we have one unvaccinated individual sa bahay, and that's me. So we ensure na we protect ourselves so that we protect our loved ones. I think that's the mantra that I'd like to convey to everyone. And when I usually go home, nakamask pa rin ako to protect, and then wait for the right time, let's say 3 days, kung wala ka ng symptoms of at all. But, we need to have this safeguard so that we will not, spread the virus from the workplace to our homes. So, ganun lang ako kasimple. But, pagka mataas po yung level of vaccination, naka-3rd dose na po ako. I had 2 Astra and 1 Pfizer. Okay naman po, but I'm looking forward to the 4th dose to protect me from the future variant. Particularly, baka dumating uli ang BA.2 and then yung Omicron XE. So, bili lang po tayo. Yun ho din na nasa guidelines ng Amerika na sinulat sa New York Times, that you have the rapid antigen test kits with you. And dali naman ho gawin because we have the self-administered kit right now. I think in about 5 to 10 minutes, pwede nyo gawin sa bahay. And it's cheaper when you buy it actually in bulk. Ang lalabas na presyo parang 250 pesos na 300 pesos. As opposed, let's say, to the RT-PCR na 4,000 to 5,000 or $80 to $100. Mas mahal ho yun. So ako, personally, wala naman masama po doon. Kasi doing that, you also protect your family and your workplace colleagues. You know, lagi ko pong sinasabi sa Facebook. You have a social responsibility, and it's important that we keep it that way. And when we protect ourselves, we protect also our loved ones and our workplace colleagues po.
Thank you for that, Dr. Liachon. Pareho pala tayo ng vaccine, no? 2 Astra, 1 Pfizer. Okay, so I have another question here for Dr. Harshan. What is the active ingredient of your mask that makes it antiviral?
The active ingredient in the mask is a special mix of sulfonate salts with copper and zinc ions, and also rayon as well. And there is a patented technology that we have added into it as well, into the coating process. But the active ingredients on a molecular form are those that I just mentioned.
Okay, thank you for that, Dr. Harshan. Maya, do you have a question on
yes,
the
Ms.
Slido?
Cynthia. Yes, ma'am. I have some questions coming in from our Slido. Okay, so before I proceed with the question, let me remind everyone, so those who want to add the question, the Slido number is 088213. Okay, so for the first question, I believe this is for Dr. Liachon. So why is it po na di nakakapag-update ang ibang municipalities with regards to the new cases?
Okay. Well, I believe again in another concept. This is by Peter Drucker. We cannot manage what we don't measure. And I think the problem in our country is the lack of a national dashboard. And in the company, we have a dashboard. And usually we have to put in there the relevant the materials that can actually be easily understood by a lot of people. For example, what you can put there are the number of cases, the positivity rate, the vaccination rate, as well as the booster rate. And then you put that every day so that you will be able to pressure the municipal or the LGU, the local government unit leaders, to step up to the plate to fulfill, let's say, the particular responsibility. And putting in the data coming from the municipality will be helpful also for the Department of Health to update their data. The situation is like this. You get the data coming from the Epidemiological Bureau of each municipality, town, or city. And they will actually send this out to the Department of Health. So if there's a delay from the Department of Health, it's basically because of the um, local LGU leaders' efficiency. But there is a system for this, and I think the backstops at the Department of Health in trying to get this data as soon as possible. So that's the usual scenario. I think I don't think there's a dearth of data analytics that would like to help. Ang daming gustong tumulong for the government. You have the Octa Research Group, you have Edson Guido, you have Professor Trabajante, you have the UP Resilience Group, and a lot of private organization. Is that I don't know. I don't think the Department of Health is really, accommodating to a lot of data analytics experts. I mean, trying to help them out. I mean, with a lot of funds related to case data management, and these are on voluntary basis, I don't understand the point that we would be, have this kind of situation in which data management is a problem in our country. Ang daming backlogs, a lot of things na kailangan natin. Nakikita natin yan because we work in the corporate world eh. Meron tayong scorecard eh. May dashboard tayo eh. So even if the CEO is out of the country, you just look at the app and then alam mo kagad whether you're performing well or not eh. You use the traffic light infographic. Pag green, that's a go. Yellow, perhaps ongoing. Red, you're not doing very well. I mean, there must be a system for this. And this has been the problem. And that's the reason why we have not anticipated the 27 million vaccine that is expiring. Because in the corporate world, again, you measure all these inventories. And so if you have a lot of inventories, it means that you are not able to work with marketing and sales as well as your logistic team in order to deploy these particular vaccines. So if there's a problem there, what the Department of Health should do is try to partner with the experts, and usually these are the pharmaceutical companies, and I don't think they would mind lending out, the talents, the employees or the officers with the skill set that would understand this, because this is something new to the National Task Force, and the National Task Force, of course, is headed by a general. So that's a problem, and you can see the problems that we are facing. I'd like to apologize for that comment, but you work in the organization, when you hire a person, the right man for the right job, and you need a special skill set for those kind of situation. And losing, let's say, 13.7 billion. I mean, that's a lot of money. That's almost equivalent to one regional hospital. I mean, 13 regional hospitals with 1 billion pesos. And, you cannot just meet your target, but you overspend. Of course, your boss will always question you on how much you spend despite achieving your target. I don't think we can work on that kind of situation. Yun lang po ang comment ko. It's a loaded question actually, but I need you to understand that you have to shrink the problem. If the national can do it, I think the workplace can do it, and you need to just apply this particular template so that whatever will happen to the national, at least your workplace will be successful following the metric of success, following all the checklist that I actually pointed out. Then you will be successful. That's my thinking process. If I cannot do that on a national level, then I have to apply it at the family level, at the workplace level, and to people that I can influence based on the checklist that I usually advocate so that we can actually solve the problem together. Inch by inch, eventually we can come up with a solution.
Please.
Did I answer the question? That's the
I
long and
believe so,
short.
Doc Tony. So I hope the person who asked kasi anonymous lang po from the Slido. So I hope na-address naman yung question. But very clear naman yung information that you shared, Doc. So we have another question, Miss Cynthia. Do we have something for Dr. Harshantu?
Yeah, we have one here. The question for Dr. Harshant is, can we reuse your face mask and what will happen to the antiviral component?
Okay. From a scientific point of view, you will be able to use this face mask continuously one time over an 8-hour period. There is no evidence or information that we have done during the research and development phase for continuous usage of this mask. Yeah. Having said that, using a mask over several days is usually not the most hygienic thing to do. But if it is a mask that you just use just for a couple of minutes and then you're worried that does it go away? No, it doesn't go away. The antiviral layer will definitely stay over that 8-hour period.
Thank you for that, Dr. Harshant. Maya, do you have a question you're in from the Slido?
Yes, we have another question. Actually, this is again for Dr. Liachon. Most of the questions that came in ang concern is about the booster shot. So merong nagsasabi that J&J daw, dalawa daw ang booster shot. Is it true? Now, the other question naman is kung needed ba talaga ang first booster, para saan naman at ano ang advantage ng second booster? So I guess, Doc Tony, ano na lang, summary of the booster advantage na lang siguro. And I also another question when it comes to the vaccine or booster, kung pwedeng mixed brands yung gagamitin.
Okay, let me answer the Johnson & Johnson. Johnson is actually unique because it's the only vaccine with only one dose. Most when we started this last December 2020, the idea is to have the vaccines after 28 days, so 1 and 2. The longest, of course, is Astra with 3 months yung waiting between the first and the second. And Johnson & Johnson isa. So when they came up with the booster, first in the US and then the CDC, and here in our country, in the States, 3 or 6 months, sa atin sinorten natin to 3 months, and perhaps because of the shelf life. So for Johnson & Johnson, you need one shot, then another booster. For the other vaccines, which actually would have 2 doses, 1 booster na siya. Ngayon, based on the studies, because of the advent, yung pagdating po ng BA.2 and other variants, nawawala ang bisa or the immunity wanes after 3 to 6 months. And it was actually discovered in Israel. So they started with this one. And that particular regulatory document was actually used by Pfizer to apply for the US FDA and the CDC because of the waning immunity. And that was also the explanation of the academic experts why we have surges right now in Europe and also in Asian countries when you have 2 doses already and a booster, because the full vaccination is not actually 2 doses but 3 doses. For Johnson & Johnson, the full vaccination is actually 2 doses and 1 booster. So I hope it's clear to everyone. That's why we have surge right now in other countries. Kasi nag-wane the immunity, the wane na ang effect ng vaccine yun in other countries. Kaya po ganun na nangyari. Now, we are right now doing well because we just got the last quarter vaccination. In fact, we had December 3 and December 15, remember? Yung 15 million. So meron pa siyang rollover of the effect until today, which actually will be on a third or fourth month. But I doubt, based on the studies in Israel and the CDC, whether that particular vaccine last December would still be effective on the second half of the year. And that's also the reason why in 1918 we had the Spanish flu pandemic. And then every year nagkaroon na tayo ng booster every year for influenza. And even in the US, every November, nagra-rise ang influenza. So ibig sabihin, viruses are difficult to treat because they mutate every now and then, particularly itong COVID. So the right approach is to follow what the academic experts are doing. Ang problem lang is that a lot of fake news and disinformation, and ako, I'm usually a person that would follow websites na reliable and those with good reputation. Let's say WHO website, US FDA, CDC. I would follow Harvard Medical School, Stanford University, Mayo Clinic, and other universities, and of course, some reputable news outlet. Ang hirap kasi when you follow, let's say, fake news or those without references, ang hirap nun. And this is the problem that we have right now. Because people are actually hooked up to social media, and therefore we have forgotten about evaluation of good references. And that is usually science-based and usually based on regulatory approvals as well as guidelines coming from the premier medical organizations in the US and of course in Europe.
I have another question here, Doc, para sa inyo pa rin po. It's regarding the news circulating now about China. Do you have updates on current lockdown in Shanghai, China? Is there a newer variant coming besides what you mentioned already?
Well, ang China kasi is always reclusive eh. If you would read the history, they had their first Wuhan strain December 8 of 2019. But of course, they did not reveal that to the WHO. And then on January 8, they had another one. But it was only on January 25. I remember that because that was the birthday of my mom, when the WHO declared that the COVID virus in China is something of international concern. So ang tagal nung lull period between the first discovery of the strain and then as a concern. So ngayon, that was difficult because some other countries hindi kagad ng shut ng borders eh. And that led of course to the global pandemic eh. So right now we're reading some news coming also out of China, coming from academic experts. And you see right now 13,000 cases ngayon, may total lockdown ngayon sa Shanghai. And you know naman how reclusive they are, no? So I would tend to believe that we should be careful right now. And perhaps our travel guidelines should actually be stricter right now, particularly in those areas with surges. And if we will allow them, at least man lang may medical safeguards tayo to have the rapid antigen test there at the airport. Sa ngayon, I would be careful knowing that there are, uptick right now in Shanghai in some area. I think it was also in another city in China with the stealth variant, no? It's also an Omicron variant. But I would perhaps follow up and monitor this and then listen to what the WHO would say. But I would be vigilant in terms of following up the news. And I would always go to the WHO or the CDC and these credible websites, particularly in Twitter and on Facebook.
Maya, you have another question your end. Thank you very much for that, by the way, Dr. Leachon.
Yes, thank you so much, Dr. Tony. Actually, Ms. Cynthia, madami pang questions. But we ran out of time. So we allotted 15 minutes only for this. So, but don't worry, all of your questions will be gathered together and we will send it to our speakers. And again, as mentioned earlier, we will send it to them and reply to your email address. So the address that you use during the registration. Okay. So I think Ms. Cynthia, that ends our Q&A for now.
Yes, so on behalf of idsMed Philippines and PMAP, once again, we'd like to say thank you very much to our speakers. And I'm now turning over the virtual floor to our RESPO quiz master, Maya.
Okay, it's me again. Thank you, Ms. Cynthia. Okay, so let's go ahead with the RESPO quiz. Are you guys ready? And so pa-type naman ako ng 1 sa chat box if lahat na familiar sa Slido. Or type 2 if medyo nangapa tayo kanina during the Q&A portion. Ayan, so yung mga hindi pa masyadong aware, pwede kayo magpaturo sa mga katabi ninyo. Okay, ayan. So I see karamihan nagta-type ng 1. That's good. So it's so easy to use. Just scan the QR code flashed on your screen right now and you will be routed to the site. So gamitin natin yung phones natin para mas mabilis. Okay, so for this quiz, the mechanics would be 5 of you will get a chance to win a box of 5s or RESPO-Care antiviral mask or 5 pieces of individually packed in foil. So kanina po yung pinakita ko. Don't forget to use your full name when you join the game. So hindi lang tamang answer ang hinahanap natin, pero dapat mabilis din yung pagsagot. So I hope you listened to Dr. Harshant earlier during his talk. Okay? So while we are waiting for the others to join, I just want to say, kung isa ka sa mga masuswerteng player, you will get 5 pieces of antiviral mask. And kanina, if you avail the special price of box of 24 at kasama ka sa first 5 who ordered, you will get 2 pieces freebie. So in total, meron tayong 31 pieces na. Okay, so that's more than a month, more than a month of protection. Okay, so for this game, fastest finger po tayo ngayon. Okay? So we are waiting for others to join. How many numbers do we have?
28.
Okay, so we have 28. So right now we have 189 participants. Huwag na po kayo mahiya. This is just a simple game. Very easy yung questions. Again, it was all based from Dr. Harshant's talk earlier. Okay?
All
right. So are we going to wait for more participants? Okay, start screening or start taking the screenshot of the QR code before we start. So I guess we'll wait na maging 40. We have now 36, right? Okay, so we have now 36. Gawin natin siyang 40. Patasin natin yung numbers, guys. We have 186 participants here.
Yung mga taga-idsMed ba kasama sila?
So, if meron mga taga-IDS, let's join.
Hindi na sila kasama.
Okay. So, I see names here. Welcome to this game. So, I hope mag-enjoy kayo. Sayang din yung 5 pieces of antiviral mask. Ayan. So, how many do we have?
48.
Ayan, 48 na. Parang gusto ko antayin ng 60. Okay. So, should we start? Okay. So, very quick lang naman tong game na to. Pang icebreaker lang natin. Okay. So, are we ready? Okay. Let's flash na the first question. Okay. So, now the first question is, how many layers of protection does RESPO-Care have? Okay, so we have A, 2 layers, B, 3 layers, C, 4 layers. Okay. Okay, so if letter C is your answer, that is correct. It's 85% of the most chosen answer. Okay, remind ko lang po, you have to log in sa Slido kasi hindi po natin makakount yung answers nyo sa Q&A chat box. Okay. Okay, next question, please. All right. So what do you call the layer where the viruses are trapped and destroyed? Letter A, unmodified spawn bond polypropylene layer. Letter B, viraxium virucidal layer. Letter C, hydrophilic outer layer. Okay, so we have 63% of the virucidal layer. That is letter B. Okay, next question. We only have 5 questions, huh? Okay, so the third question is RespoCare antiviral surgical mask and N95 respirator effectively destroyed 99.99% of the virus challenge over an blank period. Letter A, 4 hours, B, 6 hours, C, 8 hours. Okay, correct. So 85% answered letter C. That's correct. It's 8 hours. So for the next question, that's our fourth. Oh, sorry. We have a leaderboard. So the first or the number 1 is Nyrel Landayan. Number 2 is Amor A. Number 3 is Rochelle de la Cruz. Number 4, Marikit Tolentino. And number 5, Ian. Okay, so hindi pa natin kilala si Amor A and Ian. Okay, but later on, we will check kung sino po yung first 5 na mananalo. Okay, next question. This is our fourth question. There are 3 available versions of RespoCare antiviral mask. Is it true or is it false? Okay, that's true. So we have the 3 available versions of RespoCare antiviral mask. Is first, of course, the one I showed you kanina. For the adult, it's antiviral box of 24s. We also have 5s, and we have N95 respirator plus. It comes in a box of 30, and we also have a child mask, antiviral mask. Okay, so for our last question. There. So InnoQ is IDS Medical House brand. InnoQ stands for okay, 95% got the correct answer. It's innovation and quality. Okay, so let's check now the winners. Okay, congratulations to Kevin Jacinto for getting the 5 correct answers out of 5 questions. So, ang bilis ng pagsagot, it's 45 seconds ang average niya. Congratulations, Kevin Jacinto. Please type in your details at our chat box and we will contact you later on. Okay? Okay, so did everyone enjoy? I hope it's also a learning session for you guys to get to know more about our product and our company and also our brand. Okay, so okay, now on the last part of our surprise for you guys. Let me remind you to please follow us on Facebook and Instagram So we have the QR codes shown on your screen right now. It's for FB, it's at InnoQPH, that's one word. And for Instagram, that's at innoq.ph. You can also check our website. It's www.idsmed.com to know more about our company and the rest of the products that we cater. So again, we also have the QR codes for Shopee and Lazada stores. I'd like you to also follow our shops because this is our last surprise for you guys. Can we flash the surprise?
It's already there.
Ah, okay. Sorry, hold on. Medyo naglalag lang sa akin. Okay, now, okay, hold on. Okay, there. I'm sorry. Okay, so this is our voucher code that you can use from our Shopee and Lazada stores. Again, Shopee and Lazada stores. So use the code idsM IPCW. So if you use this code, you can get 10% off with a minimum spend of 500 pesos, valid until the end of the month or April 30, 2022. Okay, so we are also available at Watsons and Landers, but you cannot use these codes, only for our e-commerce platform for Lazada and Shopee stores. Okay, so in using this code, you can also purchase the rest of our products, not just the Respocare mask. We also have our N95, our child mask, and Zuno surface sanitizers. So aside from the promos that you may enjoy from those platforms, this is an additional discount for you. Okay, so start following our stores and check our products, and then use this voucher code. Okay, so I think this is now the last part of our session. I hope you learned so much and enjoyed today as much as we did. And so for you to remember, just take a screenshot para magamit niyo siya later after the session. Okay? All right. So again, this is Maya Benga.
This is Cynthia Saraiva. So we'd like to thank you very much for joining us this afternoon. Until next time, goodbye and see you in our future webinars.
Thank you.
Bye.
Goodbye.
Ako'y nakapagsuot ho nito at gusto kong ipakita sa inyo. Meron ho nagbigay sa akin at ako'y na-intriga kasi ito po yun yung N95 malambot to Akala ko po kasing tigasuto ng N95. Hindi pala, no? Nagpadala sila at tiningnan ko. Gana rin ang itsura ho. So, ayan po itsura. Respocane, ang lambot. Kasi kaya hindi ako makapag N95 ho dun sa Manila Doctors at nagdodoble ako. Ang kapal ho kasi nun. Ang hirap po, no? So ito ho, kung makikita nyo, para siyang N95. Talagang N95 siya, kaya lang manipis po siya. Meron siyang pinadala na yung ordinary surgical mask. Ang ganda ng hinga ko dito Sorry ho yung air, nakakamas hinga ho ako dito. Hindi ako nagpo-promote, no? I'm just trying to show you na kailangan ho, meron ho kayong magagandang mask kung mag-out of town kayo sa malalamig na area or mag-out of the country kayo. So magdadala kayo ng mga mask na magpo-protect sa inyo. Siyempre, magbabiyahe tayo. Siyempre, kung kayo pupunta sa Hong Kong, pupunta ba kayo sa Hong Kong? Hindi ko alam. Pupunta ho ba kayo sa Amerika? Hindi ko rin ho alam. No? Yung mga ganitong mga technology, itatry natin para sa ganon, maprotektahan tayo. Tayo naman ho, open sa ganyan. As long, re-research natin, pero maganda ho, no? At Ang sinasabi nila ay may outer layer sila. Meron silang, ito pala may mga layers pa pala to para ma-protect. Ang bottom line, ang gusto ko lang ho sa inyo, kaya ko inuwento ko kasi malamig ang panahon, lalabas tayo. Siyempre gusto nating maingat ho tayo. Alam ko, iba naman sa inyo magpupunta ng beach. O di okay lang, maganda ang, paano kung indoors ko? Kailangan mag-ingat pa rin tayo. So face mask po ang solusyon. Ang kailangan natin ay hand washing. So magdala tayong maraming mask. Kung makakapagdala tayo ng mga N95, yung magbiyahe sa abroad, mas mabuti. Ibig sabihin yung pang-hospital, talaga namang makapal po at mahirap din huminga. Pero safety ang kailangan.
Ano